Hello and welcome to this podcast. My name is Freddie from 2 Pixels and I'm here with the legend, the man himself, Dr. Cormac Joyce, who is arguably, I would say, the top plastic surgeon in Ireland. And he and I have been very fortunate to have been working together since around 2020. And in that time, I think we've accomplished some pretty cool things together. But in this particular interview, we're going to be specifically talking about Dr. Cormac Joyce himself, talking about his, I don't want to say rise to power, but that's kind of like how I feel about it. his experience, the way that he became who he is today, how he started his plastic surgery practice, why he went into plastic surgery, building his brand, and how he is able to basically grow his clinic and get his insights on that. So I think this is a really interesting podcast for anyone who is either a current plastic surgeon who is looking to go independent perhaps, or someone who is aspiring to be a plastic surgeon in their career. Maybe they're a medical student or something like that, and to kind of hear it from the man himself. So Dr. Cormac Joyce, what inspired you to pursue plastic surgery?
Thanks very much for the introduction. Freddie, was it? So I mean, I wouldn't
You
say
pronounced it correctly this time, thanks.
I actually feel like I'm just starting out, Freddie, to be perfectly honest with you, that we haven't even risen to power if such a thing exists in plastic surgery. And I'm certainly not the best plastic surgeon in Ireland, I can tell you that much for a fact. So I suppose what is different to me is that I'm purely aesthetic, and I think I'm the only one in the country really. But I went through the whole plastic surgery training scheme and on the specialist register, so I'm kind of fully trained, specialized in plastic surgery, but I'm focused on aesthetics and I don't deal with any of the non-aesthetic stuff, which is probably a bit unusual because most of the other surgeons would be dealing with the private health insurers, which is a massive massive part of their income, and they would cover, private health insurers would cover all things like skin cancers and stuff like that. I think it's a little bit different in the UK and elsewhere. I think every country is a little bit different in the way they run their health service. So being kind of independent in that regard, it's a little bit different. And I always wanted to go down this route, and you couldn't really talk about it much, or certainly shout it from the rooftops because it was pretty frowned upon. And certainly you were never expected to say you were going to do this full time, and you're always frowned upon. And I think there's kind of two reasons behind that, or two kind of thought processes. I think the younger group of your seniors had never been through the aesthetic, industry, never worked in the aesthetic surgical side of things. They have not seen or felt the actual pure job satisfaction that exists. They wouldn't know about it, and I didn't know about it really until I started. Genuinely,
yeah,
the amount, it's incredible. That's one side of it, and that's the younger group. Okay, the older group don't want you kind of doing it purely because it's a fear that you're muscling in on their territory, and then that's kind of across the board really. So that's really why it's kind of frowned upon. And so once I kind of stepped out and went, well, Jesus, I don't care. I mean, you know what? I love it. It's great. And the job satisfaction that came hit me like a train. I was just bowled over. And I think I go back to something that the surgeon who operated on Kris Jenner was speaking on his Instagram. I think it was an old video. And he's married to a rheumatologist. And he's saying he's got this drawer in his house full of letters and, cards from thank yous from patients, full to the rim, hundreds and hundreds. And his wife has one and he's got 3 in them, 3 cards.
Yeah.
And that kind of shows, I suppose, you hear more satisfaction. You get more satisfaction from
you genuinely help people.
But I mean, it is, and it kind of sounds almost cliched, but it can transform some people's lives. Putting 2 balls of silicone in a young girl's chest can absolutely create a brand new person.
Absolutely.
Self-confidence, self-esteem, and that can have a profound effect on mental health for some people. So, it's not what you see in the papers. It's not what you see on TV, which is the shock value stuff, which is the botched, with these massive treble H, breasts, looking for which the implants about to, burst out through the nipples. It's not like that. It's average person is going for plastic surgeon. They're not looking to be Kardashian. They're going with an area that they don't like, that they want corrected, an area that they're causing them, depression in some people.
I mean, I totally see where you're coming from with that. I mean, I had plastic surgery when I was about 17 years old, but I had gynecomastia. So I had idio gynecomastia. I had an unknown reason why I had a male breast tissue growth. And that was really impacting my life.
But I mean, at 17, it's an awful age to have it. You know what I mean? You're young, you got to take your t-shirt off. It's affecting you. Do you know?
Exactly.
I mean, and that's a legitimate reason. You know that you can understand why you'd be genuinely kind of breast tissue in male.
Yeah.
It's abnormal. But there's even the other side of that is the dad bods. I think there's one guy we were operating on, and he had typical dad bod. Typical. There was nothing you wouldn't point and laugh at it. You saw that in the swimming pool at all. Just a typical dad bod, as they say. But he wouldn't take his shirt off for like 11 years.
Yeah.
And he's the most confident guy you meet. But even though this confident guy has something, that they kind of want, and I'm not saying everybody has, I don't know if everybody has, but certainly a lot of people have,
Yeah.
and if it's fixable and if it will benefit their, their psychological,
Quality of life.
well-being, exactly. If it does that, and you have to take that on board as well, that's as important as that, that is the key to success. It's their expectation. What's it going to do for them psychologically?
Yeah. I mean, I was rewatching some of the videos we did with like Mona, for example.
Yeah.
So Mona, I believe she was in her late 80s.
No, she was 85 at the time of surgery.
85 at time of surgery. And, the way that she's a very sweet lady, and Cormac did a whole video series with her, and just wonderful personality she has. And Cormac, what you did quite a few different surgeries with her.
Well, I think just two. I didn't actually realize when she came in for the morning of surgery that she had two previous facelifts before, which made it quite a difficult procedure. I must say, very difficult because she's very thin as well, and she also had a lip lift done, and she didn't realize she had one of those done before. So it didn't upset the surgical plans, but certainly the fact she had two previous surgeries did. So it was a very long procedure. It was under local anesthetic, but she looks great. She's delighted with it, and she skipped up the stairs the following week. Skipped up the stairs, And
no, I'll say in the videos. So you did a different video series, and you can see her smile coming through. And she had a smile already, obviously. She was skipping up the stairs is a great way of describing her.
Well, she did, and that's the thing. It just shows a lot of the recovery is down to mindset, and that's absolutely. 100%. I couldn't say that. With more gusto.
Yeah. So then you were originally working at a clinic in Ireland, and then when you decided to go independent, what was kind of like the driving force behind that? Well,
I was always going to go independent. That was the plan.
Yeah.
Definitely, it was always going to be. I was never going to settle in that clinic, ever. For long term. So there was talk of the clinic I worked with in the UK coming over and stuff, but that never worked out in the end. But even still, there was always the plan was to go solo, because to control my own destiny, so to speak, and not work for somebody else. And seeing the bureaucracy that exists in the private hospitals, where you kind of thought that surgeons have autonomy.
Yeah.
But they don't. They can't even get operating space. They might get 1 day a week. So it's just ridiculous. So what I wanted to do was, I don't want to be operating 1 day a week, or I don't want to be operating 2 days a week and having to drive across the country for the second day's list. I said, look, I've got enough patients to fill a week's list. So why not have 4 days operating? Why not set up your own theater?
I mean, at that time as well. I mean, in terms of like moving independent, you were already kind of building a very high reputation for yourself as well.
I was lucky because I was working in the UK. I was coming back at weekends, and I was doing a bit of operating here, but I was able to just. I mean, when I went kind of from, and that's thanks to you, and it's all thanks to you actually. When I went independent, no, I genuinely mean that. It absolutely is. When I went solo, there was no drop in income. It was a smooth transition, because normally when you go private practice, there is a huge.
It's a risk.
No, but there's a gulf in your income for several years to establish yourself, and I never had that. Well, straight, my operating lists were filled. I wasn't.
Well, I think I won't take all the credit for that, because I mean, you did have a very good reputation.
I think it takes a couple of years to build up reputation, right?
Yeah.
To get word of mouth, referrals. What you did, and it was quite simple. It was paid ads on Google. Was that what we were doing? The paid ads.
But when we started off, it was actually Facebook ads. But
I mean, you fed my family, because all the patients were coming from there.
And you fed mine. High five.
But I mean, but but I mean, there's no getting away from that. That's a fact. Because every single patient came to the door, came through that inquiry online.
I think one of the coolest things about you and I is that we've developed a really cool relationship as well. I mean, we've never actually met in real life yet, which is funny, but we're based obviously in Spain, you're in Ireland, And I mean, at some point we need to come and have a working holiday, let's say.
Yeah, you keep
Talk
inviting
shop.
yourself, Freddie.
I do. I keep inviting myself, but
You're more than
at some
welcome,
point
Freddie.
it will happen.
Come over anytime, Freddie. Love to
So
meet you in person.
appreciate that. But like, what was? Did you have any sort of like concerns about doing it, or was it?
Never will. That was always no. I don't, and I never feared it. You know, I wouldn't be an adventurous risk taker in terms of business. I knew what I wanted, and I finished my training. I had a kind of my last year of training was incorporated as a consultancy role, and I knew hospital medicine or hospital surgery was not for me. Do you know what I mean? It was just God. I mean, my registrars were earning more than me.
Yeah.
It's like what's going on? So, and then it just worked out pretty well. I was able to kind of practice what was taught to me, in the UK, and practice it back home, and that was a smooth transition thanks to you. And then kind of went, and I've been for the last 2 years, purely local anesthetic stuff, facelifts, and that's, I mean, we've done a lot of work on that.
Well,
and
I think it's a good segue into, you can tell us a bit about the reform, which was basically the main thing that we started marketing initially. I mean, you've done a lot of work with like breast augmentation and things like that, but the reform
but I mean, but that was the big thing. That's why I went to you originally. Wasn't that alone really, because that was going to be the thing that we were going to push. So I suppose when I got trained, I learned about how to do kind of facelifts and facial work under local anesthetic, and loved the idea of it, and kind of took that concept and kind of brought it on myself and did my own kind of take on it, and still developing it to this day. And it's become a lot more complex,
comprehensive.
Totally. I mean, Jesus, it's gone from a quick enough procedure to a very intense procedure, but a huge amount of work. It's huge, and but that's kind of been great, and that's been you've delivered an unbelievable amount of bums on seats.
It's an easy, as a product, like it's an easy product to sell. I mean,
it's not, and I can say that the cohort of patients who go for facelifts are an unusual bunch. Do you know?
That's true.
People go for a breast augmentation or tummy tuck. They go, I want to go next month or next week.
Mm-hmm.
The facelift patient will come in, and you may not see them for 2 or 3 years. Do you know? And it's so secretive as well. I mean, half of them don't even tell their husbands, because majority are female. Don't even tell their husbands.
There's still that stigma even with their.
I mean, we're 10 years behind the UK, I think, in terms of aesthetic acceptance. And definitely, we're still behind. We're kind of slowly. I wouldn't say catching up. We're still lagging behind, but we're slowly seeing improvements. But it's still very much a stigma. But face more so than anything. It's the only procedure where I ask patients, who's at home with you, and do they know you're having a consultation, or that you're interested in surgery. Because half of them, their partners are unaware. And even some of them are unaware they've had surgery at all, because they'll go and hide out with their sister for a week. So that's the stigma. But it's much more accepted in the UK. That's one thing I have to kind of say. Much more accepted.
I think this is where you and I always kind of like butt heads, because I'm a marketer and a sales guy, and Cormac is obviously a very talented plastic surgeon. So when I say it's an easy product to sell, I don't mean like, sort of, pushing things on patients, but I mean in terms of like talking about the reform facelift, it's an easy thing to talk about as a product in itself, because it's local anesthesia, which is major.
But it's a gimmick at the end of the day, and the gimmicks are not bad things. Do you know? It's got its place, and it's very attractive to people because it's local anesthetic. That's the gimmick. That's why it makes it unique. That's its USP.
Not just that, no drains.
No drains, but it's a local anesthetic. That's by far and away, because there is a group of people in a certain age group who think they're going to die when they have a general anesthetic. Do you know?
Yeah.
And general anesthetic is very, very safe. It's very, very safe. It's one of the safest things you can have done. It's the twilight anesthesia, which is far more dangerous.
That's interesting.
Yeah, because you often get the anesthetic drugs without securing the airway. So that's why it's more risky in certain cases. So that's the selling point, is that it's under local anesthetic. But it's quicker recovery because of that. You don't have the hangover from the anesthetic drugs. You don't get you have to hang around in hospital. You don't get that waiting around beforehand. The anesthetic assessments, things like that. So that's a major. That's the selling point, essentially. And then I suppose and then you got to get to do more of them, and then your reputation becomes better, and it's just it's practice. Just like being a golf, I suppose. The more you do, the better you become.
I agree with that, and I think now we're seeing a bit more of an interest in surgical, because I think, as you said, surgical had more of a stigma and a fear attached to it, and there, for many years, maybe it's the whole Kardashian thing, but we saw a lot of like injectables see a big surge. And now I think it's kind of turning where people are getting a bit concerned about the health implications of
It's
injectables.
filler fatigue. Do you
Right.
know? And there's
Right.
recent kind of studies coming out, you know, and I could be singing for years about this, is that, you know, it doesn't disappear, filler. You know, it migrates, you know, it moves from where it was put in. But there's denial on certain sides, you know, the injector sides, and it doesn't migrate, it disappears. It doesn't disappear. They don't look under the bonnet like we do. Do you know, we see some filler that's been there 10
For
years ago.
years.
And it's shriveled up. It's not causing any problems really. If you go after it, it can cause a bit of bleeding. So you gotta leave it alone. The big issue I have with filler though is, and why people I think is getting it dissolved. There's a lot, and some people are in denial about it, and I don't know how they can be. There is collateral damage to the tissues, the healthy non-filler tissues, and there's no doubt about it. You know?
Yeah. I mean, we don't just work with plastic surgery clinics. We also work with aesthetics as well. So this is something we're navigating with some of our non-surgical clients currently. One thing that we're seeing a big push towards in their industry is the non-filler sort of like rejuvenation. This is kind of like what I've been saying for a while, and we've had an interesting journey with your clinic team as well, who, by the way, are sublime. They're amazing. I think you've really developed a really amazing team behind your clinic. And, you know, we have our bi-monthly meetings and stuff, and we talk about results and different things we need to do. And honestly, it's such a breath of fresh air, you know, how everyone knows their role and works really well. And you know, it's becoming an even better well-oiled machine. And actually, when you open your new space after September, I think that's going to be a massive step change as well.
Yeah, it is absolutely.
But we went through a journey with like talking about, you know, how in terms of like, you know, the actual process of talking to patients and things like that. One of the things I would say is like, okay, one of the big issues with surgeries and plastic surgery and even with aesthetics is like, what's the cost, right? And that's like the biggest sort of like barrier to entry for a lot of these patients. Like, okay, how much does it cost? You know, it's an important thing to consider. But I always like to frame things as like, okay, well, if you have a patient who's had multiple repeat non-surgical treatments for, let's say, a decade, what is the cost of that when, you know, they could have then had one and done with a reform for more or less, I would imagine, the same cost, maybe even cheaper.
You've got to understand, like, I'm the nuclear option. No one wants to come to me.
Sometimes
you know?
the nuclear option is the better option.
But it is, and it's also actually the cheaper option, because people on average would have spent well over 20 grand before even darkening my doors. Do you know? I'm the last stop in the station. You know, no one wants to actually have to face the facts that they're going for need surgery, or, you know. I think I'm seeing more and more people now just, you know, sidestepping completely the non-surgical side of things and going straight.
Well, I mean, it is more intimidating. You know, you have the whole stigma attached to it.
Totally, but I'm seeing more people completely realize, well, not realize, but I say be quite skeptical of the non-surgical stuff and what it can produce, and seeing filler faces, you know, the pillow faces, whatever, and going, not for me. And you have, how can you compare something like, you know, the bad filler? You only see bad filler. You know, that's really what you see. You only see it. So you're comparing bad filler to something like Kris Jenner last week, night and day. But good filler, you know, you shouldn't even see it.
What do you think she had, Kris Jenner? Because it was a massive. She looks like 40 now.
Oh no, she had Getty Images doing a fair bit of airbrushing as well, but she had a non-deep plane facelift, and she had resurfacing, possibly some fat grafting as well. You know, but I think if someone analysed the photos, there's definitely a bit of a tomfoolery going on there with those ones that were.
Gotcha.
But no, but I mean, that's, you know, I still think she's got a great result. I mean, she went to a very, very good surgeon. But yeah, she's had kind of skin resurfacing. She's had volume. She's addressed the three signs of an aging face, which is kind of laxity. It's the loss of volume, and it's the skin surface. So hit the three targets.
And so getting back to like the business side of being a plastic surgeon.
Yeah, I'll jump in, Freddie, and I just want to say, because when I was kind of finishing my training, at the last year of that, I did an MBA on the side, kind of an online one. I kind of was interested in business. And I
actually had no idea you had an MBA. That's really cool.
Yeah. There you go, Freddie. You know,
not just a pretty face.
No, you should have had it actually on my name there at the bottom. But
I can update it.
Please, would you mind? Just go back and put it there. So I did that. Now it's not kind of, you know, wouldn't be kind of the best, you know, MBA in the world, but it's taught the basics and stuff. But going back into the real world, and applying what you've learned is completely, you might as well not have done anything, because I don't know how to manage people. I don't know how to manage non-clinical people. I don't know what job descriptions are. I don't know how to finance payroll. Not a clue. There's no manual. There's no self-help book. You learn on the fly, or you learn for having employ people who've been in the system before, and they're gonna go, what the hell are you doing there? Do you know? And a hand on heart, like for a business like mine to run, and will be when we start with a new clinic, I can't run it. I'm not able, as a surgeon, to be a manager, a business manager, and a surgeon. I have to, and you can't. You have to employ someone else to do that side of things.
I totally agree.
My skill set is surgery, and I should pretty well stay in that lane.
Yep. Me too. I'm the same. I'm a business owner. We have a team of 4 people. I am so terrible at managing people. Yeah, I'm awful.
It's a hard job.
I can't do it, and I can't do accounts and things like that. I just get brain fog. I'm like, show me a computer in the back end of a Google Ads account. I'll sort it out. Yeah. Anything else, useless.
But I mean, that's what you need. You need a manager. Do you know what I mean? You need kind of a clinical, kind of admin side manager. You also need a business development manager. And you can't do that as a surgeon. You can't do that. If you're in marketing, it just eats away from what your skill set is. Put someone else who's got that skill set in the job, and you'll get far more out of it.
And it allows you to focus on giving your patients the best experience possible.
I shouldn't be like near management. Do you know what I mean?
Yeah.
Shocking. With an MBA, no way.
I updated your name, by the way, just so people are aware.
That's great. Yeah, that's great. It could be Cormac MBA Joyce, actually.
Or MBA, just Dr. MBA.
My Instagram handle, I like it.
Yeah.
But so, what was I saying there? So you can be prepared all you want, but it's actually when you're thrown in, it's like I haven't a clue. And it's not the different business, the detailed, comprehensive business strategies that you need. It's the simple day-to-day stuff that you just not a clue.
But I think the important thing is like and I like your attitude to this, is like to do the thing. So a lot of people sort of put off, I mean, generally, like not just necessarily in the plastic surgery industry, but they put off starting a business and stuff like that because they overwhelm themselves with trying to be perfect from the outset. And no one's perfect. You're going to make screw ups, and you just have to do the thing and give it a go and try your best. But I think with the plastic surgery industry, especially, like, I think it's really important to it's actually plastic surgery itself is a little less competitive than like the non-surgical aesthetics. There's a lot of people because the barrier to entry is much higher being a plastic surgeon. But it's still important to differentiate yourself from competitors and to build also to build trust. You have to be able to communicate trust to potential patients. But in your view, like, what is maybe like couple things that you can say like that you think are very important if you are going independent as a plastic surgeon?
Well, I think honesty, transparency is absolutely key, and amazed. I mean, the feedback we get is that, oh God, you guys are so honest, so transparent. And on one side, it's flattering, but the same side, you're kind of going, why is that meant to be? Why are you even saying that? That should be across the board.
Yeah.
I mean, if you're not honest with these patients, it's going to bite you in the arse. Yeah. Being dishonest is, operating on things you shouldn't, or selling things you shouldn't. You're causing, controlled trauma to someone's body. You're causing permanent damage to their body. And if you're not honest,
or if you push a treatment on someone who's like either not ready for it or doesn't need it.
It's not. We're not selling used cars.
Yeah.
We're not selling temporary things like Botox. Even it's even different, but not at the same time. But it's not, because I look at people who do thread lifts and kind of go, "What are you doing?" You know they don't work. You're putting barbed wire through someone's face, causing trauma to the tissues, and you say it promotes collagen. It promotes scar tissue. So does a scalpel. So, but that's just the media, and it's in the industry. People still get it done. Still sell, swear by it. It could be the placebo effect. But I mean, the placebo effect was shown that it acts like morphine when it was a saline. So
So being honest, I think, and that's the feedback we get from a lot of your patients. I mean, by the time they actually come to you for consult, they've been through a few steps. They've spoken to one of your team members. She's kind of like vetted them and made sure that, they are of age and able to undergo treatment, kind of understand what she can share on the phone about their particular medical situation because of lots of rules and regulations and things like that. But then,
they can send in photos as well, which is very useful.
And they send in photos, which is very useful. So she manages all that. And then by the time they come to you for consult, I mean, you do turn away a few patients.
Oh, I'd say about 15%.
Yeah.
Which is, some days you turn, a lot of them. But I mean, we're lucky we can do that, I suppose. We don't, we turn down, I operate on what I think is appropriate. And if I think I can make a difference and make it, improvement. Yeah. But I won't be operating on something that I don't think, that I agree with, or something that I don't think the patients can, it's going to improve the patient. So you have to just bow back down to honesty again, You have to be honest, so honesty and ethical. And that's, I mean, you've got to, even though I got an MBA and I thought I'd be a bit more ruthless in this business than I am, and I'm not at all. And I'm very much stuck by my medical ethics. And they will be with me till the day I die. And the MBA can take a back seat. And that's kind of surprised me. That's another thing. But so that's really the most important thing. You stand by your guard, you're honest. You don't screw over the patient. You don't rip them off. You're accessible. They're paying for a service. It's 2025. Gone are the days where the surgeon, is not contactable with the patient.
Yeah.
Yeah,
I agree.
You're directly providing them a service for a significant amount of money sometimes. You should be there for the recovery every step of the way and be available to talk to them and reassure
100%.
them.
100%. The biggest complaints we've seen from businesses is if the patient feels like once they've undergone a surgery that they're kind of like dropped off.
It's the aftercare. It's essentially aftercare. It's cash grabbing kind of, vision. And aftercare that's after their post-operative journey. This is probably the most important part of the whole thing.
Yeah.
How are they recovering? And that's, but it's kind of cash grabbing, and it's all about the end game. And it's very common in clinics that are solely run by business people.
Yes.
The best, I think the way to do it is have the business person and the clinician running it. So you've got the best of both worlds. Do you know what I mean? That the business man or woman take care of the business side of things, that the surgeon take the side of the surgical side of things.
There's a couple in Ireland, but we will not name them. But like, there's a couple.
Is there?
Yeah. A couple of competitors of ours who, I feel like.
No. Not competitors.
No, you're right. Yeah.
We're very different cohort of patients.
So trust and transparency and being honest to your patients. But then in terms of that's very important, obviously, once they actually meet with you. But in terms of I think for the people who are starting out and are thinking about setting up a business, do you have any advice for them?
Yes. Digital marketing, 100%. 100%. That's, because the clinic I worked in the UK, and that's where I became aware of the importance of digital marketing. And that's how I become aware of you, as opposed to a person who's in in-house marketing there. And that's key. It's proven. You've proven it. That's my first 2 years in solo practice. Every patient who came through the doors pretty much was delivered by you.
Yeah. I appreciate that. I kind of come from so we speak with tons of businesses. Roughly about 60% of our clients right now are in the medical, plastic surgery, aesthetic space. But you're obviously the only one in Ireland. We're going to keep it that way. But a lot of these people are going freelance. I think is a good way of describing it. And they all say to us like, okay, can you run ads for us and things like that. And at the moment, we're turning away a lot of business because we don't think they're ready to run ads. So digital marketing is not just like running ads. I think what's so important if you're starting out, just from hot take from me, is like do organic stuff first, build a little bit of a following, whether that be through, doing organic posts online or doing blogs, or YouTube is just such a big channel if you're just starting out nowadays, and create content and then see if you're ready to launch ads, because otherwise ads are great if things are running well.
We were a little bit different because we have solely of the facelift, which is kind of different. That was a product essentially.
We started marketing a product. Yeah. So that's the difference between is that when we first started working together, we created basically a whole funnel based on the reform facelift that Dr. Cormac had created. And that was a really interesting way of marketing a particular treatment. We were not running ads for plastic surgery in Ireland, right, we were running ads specifically for a procedure. And then after that, once we kind of got proof of concept and we rebuilt your website and stuff, then we started marketing a few select treatments that you wanted to push, and that, you know, you had the facilities to do because you were limited by anesthesia options. But that's going to change now in September, once we're going to be able to offer general anesthesia treatments with your new clinic. But I would say, if you're just starting out, or if you're thinking about, if you work, I mean, I think a lot of the cases where, similar to where Cormac started off, is you're working at another clinic and you're thinking about going solo, it's a good opportunity to then start building out your own personal brand organically.
100%. That's what I'm saying. It's not so much a gimmick, but you need to kind of put something together that makes you stand out, that's unique. Do you know?
Yeah.
That's what you need. Do you know? I was lucky with the tummy tucks and now with the facelifts as well. But something like, even if it's a package of several treatments together, do you know, something that is unique because it's separate from everything. You know what I mean? There is a reason why it's a gimmick. You know, it's not a, you know, that's what I would recommend, rather than, you know, it's an easier way to get to the ads.
It's less risky as well when you're working for another clinic, and you can start, like, you know, kind of building out your personal brand a bit. And then once you're at a level where you have a little bit of a following, then you can look at, okay, creating a website that is about you and your personal brand and things like that. We actually created a course on this, which is part of this whole interview package, which is about how to set up and launch your own clinic. And we've actually had lots of good feedback from it, which I was really happy about. A lot of people say it was like really digestible and things like that, which is awesome.
You must send me on the content of that. I'm interested to have a look at it.
Yeah, I will do. And so let's just think about this one. I'm going to say now. We can just pause there for a second, Cormac. Is there anything else you can, like, want to talk about?
No, just flip a few gang signs and we're going. No.
Maybe, I don't know if you want to talk about, like, we've kind of touched base on choosing the right team. We've touched base on attracting the right patients.
Well, Freddie, you direct me, Freddie, because I don't mind. Like, you know, I
think it's been a really good conversation so far, honestly. Like, I'm really enjoying it. We've done clinic differentiation. Kind of touch base on that. We've done advice to other surgeons. I don't think there's anything else really we need to touch on.
I suppose the different markets for different. I mean, Ireland's a very different market to the UK, which is a very different market to Spain. Do you know what I mean?
Yeah. I think it's different in terms of, I mean, I think, we can talk about that. So in terms of markets, you've always said that you think Ireland's a very different market than the UK. And I agree in principle on that, but just expand on that. What do you mean by different market?
Well, I mean, let's look at the way it is in where I worked in Tunbridge Wells, which has a population of 60,000, and there's like 4 cosmetic surgery dedicated hospital clinics where you could have, cosmetic surgery. Ireland has a population of 6.9 on the island, and there's like 3 clinics, and the demand is out there. The demand for aesthetic surgery is massive, but the problem is it's the trained, specialized, specialist register plastic surgeons are not getting enough of it, really, or not being able to do it as much as they'd like, or the patients aren't being able to be operated on by enough of these people because they don't get enough time in these private hospitals. I alluded to earlier, they make it 1 day a week, so their waiting list piles up. People are not willing to wait
6 months,
18 months. It's not 6 months, it's 18 months, because all these surgeons will have skin cancer patients as well, which bump things along. So that's when they go to these other kind of privately run clinics where you've got, fly in, fly out doctors. You've got overseas doctors who are on the specialist register, but from what country? But with the standard of training is God knows what. And they're not members of the Irish Association of Plastic Surgeons, which is also kind of something to look out for. So that's the issue. Is there's not enough theatre time, not enough theatre space for plastic surgeons, and there's not enough theatre space for the population as a whole. They don't have enough options, and there should be. There needs to be a competitive market. There's been 2 players, maybe a third as well in the last number of years. There should be way more.
Yeah.
Way more.
Do you think it's easier then to be a plastic surgeon business in Ireland than it is the UK?
Yes, it's without doubt. I mean, I think for me, as I said, I'm the unicorn in this country. I'm the only one kind of on my own doing it, which is ridiculous. There should be way more of me. Do you know? I said the population. You know how many aesthetic surgeons are out in the UK? You know, hundreds.
There's a lot. I mean, we work with a few plastic surgeons in the UK currently, and in terms of like actual marketing costs, like how much it costs to run an ad on, let's say, Google, it is double the price than it is in Dublin.
London.
Well, yeah, London specifically. I mean, you know, if you're in the north of the UK, it's cheaper.
Well, you should be comparing London to Dublin, really.
Do you know? No, you're right. You're right. You're right. No, but I think
I say it's a lot more than twice already.
No,
in London.
I think it depends on, I'm going to toot my own horn, it depends on how good your marketing setup is, because costs are relative. I mean, the cost per click...
Bidding for the facelift.
No. So the cost per click is higher in London and Dublin massively. But if your like website is set up properly to communicate the things you need to communicate to people, and if then you're backed up by a personal brand that is strong, such as yourself or whatever XYZ leading surgeon in London, it makes stuff just work a lot better, and the relative costs come down. Yes, your cost per click would be higher, but the relative cost of the lead would decrease, would be more or less the same. I mean, we're running ads right now for a clinic in Manchester, and like we're getting breast augmentation leads for like £40, which is still higher than what your leads cost, but it's cheap compared to the UK market as a whole. But obviously, if you're in London, it's going to be a bit more expensive. But in terms of the market of patients and what patients want, do you think that differs as well between Ireland and the UK?
I mean, I don't know how. Yeah, I mean, what they want. I suppose the demand for facelifts is more in the UK because that's separate. That's like an old field on its own. Facelifts, it's complete outlier. Yeah. So you can put that aside. I think it's pretty similar, the demands. I think they're far more savvy, UK patients, far more research. I mean, they shop around. You know,
they have options.
I can tell the UK patients, they're so well researched. They've seen numerous surgeons. If they're well researched, I don't have to spend 6-7 minutes explaining what a facelift is. They know already. That makes the consultation far more productive for them and for me. And they're the ones who ask the really, challenging questions, which are great because it breaks the monotony of people going, and you go mention about the tummy tuck and scar, and they go, scar? Do you know? That's how under-researched people can be. And they won't shop around, because they go, oh, we'll go to him because he's a free consultation. We won't go to her because it's a €250 consultation fee. That's not the right attitude, because you really should be putting your money in your pockets, because you might have a better, better connection with that surgeon, better results. And, so people spend more time looking for wedding dresses than they do for, complex surgery.
That's insane, isn't it?
Yeah, and it is, but it's a real Irish thing, and I don't know. It's just the lack of shopping around is just mental. Do you know?
And then going for a cheaper option as well for a consult. It's like you're doing something to your body that's permanent.
Listen, when it comes to money, I mean, there's people going to Turkey, and they're going looking through the bargain basement in Turkey.
Yeah,
and you're asking for trouble. You're asking for kidneys to be removed, right? You know what I mean? That's where trouble happens.
Yeah, I agree. I mean, we fun fact, when we first started off your ads, we were getting loads of searches for like people in Turkey, like plastic surgeon Turkey, facelift surgeon Turkey, like all that's obviously been excluded years ago now. But it is a massive thing. You do see tons of people. Turkey, Bali.
Bali, really?
Yeah, Bali. People searching for surgeons in Bali.
Thailand's popular, but Lithuania is popular, but it doesn't have the reputation that Turkey has. And people, like the media will often every once a year, or there can be a tragic death, and there's been like something like 28 deaths UK patients since 2022 or something, I don't know, and that's awful, but that's only the tip of the iceberg. Because
what about the people who get like serious injury? Yeah,
there's people who end up with essentially what I hate the word botched, with damaged like nerve injuries in the facelift that are permanent. They're not correctable. Do you know? Yeah. And people don't see that, but that's the vast majority of the problems from Turkey. It's not the deaths.
Yeah,
it's the unhappy patients left with terrible complications.
And that's if you were a patient looking for a plastic surgeon, like what are the couple questions that you would, as a patient, ask the plastic surgeon to determine if they are
okay? That's legit. Good. I mean, okay, you want to establish their qualifications, verify that. looking, are they on the specialist register of plastic surgery, okay, in Ireland? And also, are they a member of the Irish Association of Plastic Surgeons? Now, that's the research you can do before you even consult with the patients. But nobody does, because it's an unregulated industry, like the UK is. And I know there's a documentary thing coming out in the UK, it will be shown in Ireland, about the lack of regulation and how the public are just completely unaware. They automatically think, they look up for breast augmentation, people online, cosmetic surgeon, they think it's kosher because it's medical, must be regulated, safe as houses. But you can be a doctor with no surgical training whatsoever, a GP, and decide to call yourself a cosmetic surgeon tomorrow and start doing facelifts and tummy tucks without ever having seen one. But you're legal, perfectly allowed. The medical council will turn a blind eye to it. The indemnifiers obviously turn a blind eye to it, because if they didn't, it would interfere with their revenue stream. You know, and that's the frightening thing, because patients are completely unaware. I was talking to a journalist earlier on this morning, and she went for a consultation. I said, well, that's, he's not a surgeon. And she nearly fell off her chair. And the intelligent woman did her research, but not enough.
So check they're on the specialist register.
Check the specialist register, and a member of the Irish Association of Plastic Surgeons, because on being on the specialist register, people who are signed off or trained in their home country, but it can be such a low level standard, so that's the thing. Being a member of the Irish Association of Plastic Surgeons, kind of, having a substantive job, what you call it, one of those kind of, a job in a public hospital at some stage.
Okay, and does that also apply to the UK market, as to the UK surgeons as well?
I think in the UK you have to be on. You can only be on the specialist register if you've had a substantive job, is what's called, in a hospital.
Gotcha.
So it's different in Ireland. Once you're kind of done the exam and you've gone through the specialist training, that you're on the specialist register. So you've no real say in it. You are on the specialist register, but it's different in the UK. It's very different, actually. Specialist register is not you have plastic surgeons who are not on the specialist register.
Understood. And I guess it's more nuanced then, because it's like, doesn't necessarily mean that they're bad if they're not on it.
Absolutely not. No, not at all. Not at all. I mean, not at all. And look, in Ireland, you might get a couple of, renegades who might not want to join, and that's fair enough. But they're actually excellent plastic surgeons. You know what I mean? You're supposed to have to ring up their secretaries and find out, where they were trained. Are they plastic surgeons? Plastic surgeon is a protected term. It's cosmetic surgeon is not.
Interesting. Because to a layman, it means the same thing.
Yeah, I mean, I think, but in the States, it's different completely. It's board certified, and then you've got a board certified facial plastic surgeon. They're allowed to use plastic surgeon when they're not. So it's very nebulous area, and it's unfortunate but there are all three issues are going on. Same issue is going on in those three countries about the lack of regulation.
Yeah.
And it's just it's affecting each, all of them. It's just the public are always hear about filler. The lack of regulation in the filler industry, and complications such as skin necrosis, or the very, very, very rare blindness. But what's sitting across the fence is the lack of regulation in cosmetic surgery, and what's the worst thing that can happen is death.
Yeah,
but nobody hears about it.
That's so true. You never hear that.
No.
To conclude, I'm going to leave it with this question. How do you see the plastic surgery industry changing in the next 5-10 years?
I don't see it changing much. I think we're going to have more fads every year, and that's going to be the thing. And it's all about, it's like facial massage. There's people making a living out of facial massage, saying it gives, long-term rejuvenative long-term rejuvenative changes. It doesn't. You got to look at the PubMed on the science, the medicine behind it. The only proven benefit to facial massage is an overall sense of well-being, of improvement in well-being. That's it. It'll temporarily plump up your tissues, but it doesn't give any long-term. So people making a living out of it, saying, giving quotes that it gives long-term, it doesn't. It's nonsense. You got to look at the science, and that's the problem. Things like deep plane facelift. It's the propaganda, and the public don't really go onto PubMed and look up the clinical data on is the deep plane better than a facelift? What are the studies? And the studies show there's no difference.
We should do a blog on that.
The deep plane, the deep plane is 30 years old. It's been repackaged and the price has been augmented. That's all it is. The studies that have been done have shown no benefit whatsoever between facelift and a reformed facelift. Kris Jenner did not have a deep plane facelift, but you had all these deep plane facelift surgeons coming out saying, "Oh, she must have had a deep plane facelift. It's so good." She didn't, and they shut up pretty quickly, So it's just propaganda. And if you look online and enter into Google, what's the best type of facelift? You see, ping, it'll all be deep plane, deep plane, deep plane. You go down the rabbit hole, you click on each individual link, brings you back to a deep plane facelift surgeon. There's no clinical data to back up anything that deep plane is better.
Well, I think that we need to go nuclear on that, and we could do a few YouTube videos with you talking about.
I have done already with Anne,
Oh, okay, cool. So you're gonna send it.
Well, I mean, I think a dedicated one that would be, I have done a video on that, but I'll have to look and see what it's like. But I think definitely that's something that needs to be trumpeted, as
For sure.
But it's propaganda. You go online, and I've got so many more arguments on Reddit with people, and it's just they're suckered. They're telling other people, "Oh, the deep plane is much better." Why are you saying that? Oh, because a plastic surgeon told me. That's you fucking idiot. Sorry.
Beep beep. So Cormac, thank you so much for this interview, and thank you guys for watching. If you have any questions for Cormac, you can reach him at his website, which is just type in Dr. Cormac Joyce into Google and you'll find him. And no, we've had a really fantastic 5 years plus working together, and I'm excited to be working with you as you open up your new space. And I think the next few years are going to be super exciting as we add more treatments to your marketing repertoire. And many more years to come.
It's been a pleasure, Jimmy. Thanks a million.
Jimmy.